In all three frameworks, the first step, step one, is the same. Undermine where necessary. I feel that this is important to clarify because I can see how this can be confusing, and I can see how students can ask, well, how do I know where it's necessary? I'm going to try to explain this the best way I can by giving you a lot of real life case examples of patients I've taken care of. So based on my experience, what has worked for me, the years I've been doing this, and what I have applied after doing some research in the literature, I've found that this topic could actually be quite conflicting and contradictory, where some are more conservative and caution to not undermine unless absolutely necessary, where some state that it is more necessary to undermine in order to achieve a better aesthetic outcome. Well, I'm learning, just like with any technique, when to undermine becomes provider preference and really based on individual training, skill, and experience. So you really have to understand the who, what, when, where, and why, and they all blend together. Let's start off with the why, because we've already touched on it when I mentioned my rules of thumb on the previous slide. Why are you undermining? Well, let me repeat. These are the three main reasons why you are going to undermine. Number one, alleviate tension on the wound. Number two, it allows you to place your deep sutures when and where appropriate. And number three, it helps you avert your wound edges to minimize scarring when and where appropriate. Now let's talk about the who. Who are you closing and who is your patient? Each patient is like a snowflake as far as what their expectations are and their concerns when it comes to scarring. What's their age, what's their medical history, and the list goes on. But case point example, imagine this. Imagine an elderly patient with thin, loose skin and does not care so much about the cosmetic appearance of the wound. Then in this case, it's probably overkill to undermine. Now, in another case example, imagine a young patient whose skin is quite tight, cares about scar appearance, and you absolutely want to do what you can to minimize the development of a horrible scar because of her concerns and who this patient is. Then in this case, you definitely want to try your best to undermine if it's appropriate, especially if there's quite a bit of tension on the wound. Now, these are just two case examples, but I think hopefully you're getting my point. Know who your patient is, have a discussion with them about it, discuss what the risks are, and overall, just use your best medical and professional judgment and try to determine if this is the right patient that will benefit from undermining. Now, what are you closing? Are you closing a cosmetic area like a Mohs defect on the face? Or are you closing a non-cosmetic area like an extremity or trunk? Well, in either area, if the skin has enough laxity to where you can obtain great wound eversion and approximation, then undermining is not necessary. If you are not successfully able to obtain a nice everted approximated wound when desired, and there is tension, then undermine. Simple as that. Keep it simple, guys. What will determine whether you should or not will be essentially from the information you've gathered based on the patient's medical history, what's their social history, and understanding the type of wound you are closing. What about patient personality? That is a big thing too. Does the patient care about scarring on his arm versus, say, the face? If so, undermine if can. If not, then don't. For all patients, especially those that have a heightened concern about scar appearance, again, just discussing with the patient prior to any procedure that you will do, let them know that you are going to do your best to minimize scarring, but there's always that risk. And those risks include bleeding, hematoma, infection, nerve injury, and necrosis. That is why it is absolutely important to have that consent for surgery signed prior to any procedure being performed. Now, when to undermine is going to fall under the umbrella of what I just spoke about and will be determined by what I just mentioned. Again, they all are kind of blending together. Determine who is your patient, what are you working on, what anatomic location. Also, think about times when you do not want to undermine. Is the patient an incoherent patient living in a nursing home who's on blood thinners and at risk for bleeding? Or is this an organ transplant patient that has a higher risk of developing infections? Or another case, is this a younger patient who's required to perform a lot of physical activity at work, doesn't care too much about the cosmetic outcome, and just needs to get back to work quickly? Then keep it simple. These are just examples of when not to undermine if not necessary, and these are common examples of patients that I see on the daily. Where are you undermining? Well, this overlaps the what are you undermining because they both talk about anatomic location. Is the patient a Mohs patient where the defect is located in a danger zone, like the temporal area, and the risk of nerve injury and paralysis is high? Well, in this case, I would definitely be more cautious to undermine and avoid it if possible. The risk is not worth it. So in summary, I'm hoping this slide helps you better understand the considerations when it comes to undermining. Know your who, what, when, where, and especially why. They do all blend together. This will start becoming second nature to you as you become more experienced and more skilled, but definitely avoid undermining if the risks outweigh the benefits. So lastly, my takeaway home message is this, and what I want to re-emphasize is know your comfort zone. This is really based on experience and skill, and with time, you will become more comfortable and confident at this skill. Know your anatomy, know your danger zones, and simply just perform the best technique you can to minimize scarring and do what you can on your part to ensure your patient's wound will heal well. And if you're not comfortable, defer care if necessary.